Hey, welcome to Pathagonia. This is Jay. First, I want to thank Wikipedia and Path Presenter for these images and slides. Today we're going to talk about HPV, PAPS, LSIL and HSIL, and cervical squamous cell carcinoma. Right now, this is a Pap smear showing LSIL. Look how larger these sites are compared to the kind of regular intermediate cells, around 3 times. This nuclei is 3 times as big here than that one. There's kind of like a wire loop kind of pattern, and there's a little bit of nuclear irregularity. So this is LSIL, and it's a little bit dark here. That's a PAP. So this is from a biopsy. It's an H&E stain. So this is what regular cervical epithelium should look like. Kind of the nuclei are bland, they're not enlarged, they're not really crinkly. But as we go here, we see this, what I call Goomba or potato kind of big cell. My soft criteria for LSIL is this cell at the top layer has to be 3 times bigger than the cells at the basal layer. In addition, it's got to have some nuclear irregularities and also be dark, or what we call hyperchromatic. And as you progress here, you'll see HSIL. Kind of a clue I use personally is it's kind of got like a streaming pattern, and you don't know which side is the bottom side and which side is the top side just by looking at the epithelium. So here, let's go to Path Presenter. This is another case of HSIL. But I just want to let you know, this is what we look for as pathologists. We look for a transformation zone. And what that means is we look for squamous epithelium, which we see here, but we also look for endocervical glands. The reason why looking for the transformation zone is so important is that's where HPV likes. It's their address, their home. This is where they like to settle. And this is where we'll most likely see the culprit. So here again, we see this kind of very streaming, very populated layer or cells. We don't know which area is the top, which area is the bottom. So this is, I would diagnose this as HSIL. This is how it was diagnosed. And if you have HSIL, then the next step for our OB-GYN colleagues is to do a LEEP procedure for the patient. And the reason why they do this kind of invasive procedure is this area that has HSIL, we don't want it to progress to cervical squamous cell carcinoma, which could ultimately, kill her. So that's just kind of like a nutshell of LSIL, HSIL, HPV, PAPS, and cervical squamous cell carcinoma. Thanks for listening and watching. Subscribe if you want to see more. Thanks.